But well, moving on, as we connect with Kayunga, there is a challenge in Mayuge. People with disabilities, in most cases, we prefer to call them people with special needs.
Persons with
special needs have raised an alarm over
differently abled people.
Yes, over the kind of indifference that is exhibited by the medical personnel in the hospitals in Mayuge. Let's hear more from Hakim Kanyere. Very good morning, Hakim.
Yes, good morning, Simon. There is a serious outcry among women with disabilities in Mayuge district over the unprofessional conduct or unprofessional behavior of health workers towards them. And according to research that was conducted by the Integrated Disabled Women Activities, an NGO which is based in Busoga sub-region, they found out that many health workers mistreat people with disabilities, especially in labor suits. The pregnant mothers are told to climb these high beds during examination sometimes when they go for antenatal. So medics ask them, how did you conceive if you cannot climb a bed? So they find such questions quite derogatory and sometimes a mockery to them just because of their body nature. So also research found out that some women are subjected to some certain forced medical procedure, for example, cesarean section, even if they are able to deliver normally. Sometimes they are forced to use contraceptives because the parents do connive with the health workers, and then they give their girls or women contraceptives, even if it is against them. So that's the situation like among women in Mayuge, and according to the research, it is across Busoga sub-region. So, and what I know is that it is also across the nation. So there is also an outcry that this serious problem is among especially those who are the deaf and also those with the mental disability or intellectual disability. So that's the situation like, but government need to improve on such services, and asking for employment of sign language experts, because they find it hard to interact with the health workers, especially those who cannot talk. So they don't know the language they use, and also the health workers don't know the language which these people are using. So that's the situation like here in Busoga sub-region, and to be specific, Mayuge. Back to you in the studio.
Well, thank you very much. What a pity. We are grappling with an age-old question. Why are nurses rude?
I do not know whether it is about the
Am
love.
I being too general?
Okay, maybe it's why are some? Because there's some who are so nice, so sweet, they make you love the hospital. But unfortunately, these days we have more of the people who are in it for the job and the prestige of I am a medic.
Not a calling.
Not a calling at all. How do you ask such stupid questions? But it's the reality, they do get to happen.
In UK hospitals, I've had a stint in hospitals, working in hospitals. They put cameras to record everything so that a person is accountable for whatever they do.
Yeah.
There used to be a time when in care homes, nurses would beat up the elderly. You know, some of these wazeis are stubborn.
Yeah.
So they would end up being slapped, pinched, boxed, but things have changed. Maybe we need CCTV cameras to monitor these. But fundamentally, I think we need to mentor, we need to orient the nurses. Sometimes you put yourself in their shoes. You're dealing with a stubborn patient.
Oh, here is it. Sometimes you just don't have to force people to go into a particular profession because that's where you belong. Because mom is a medic, dad is a medic or something like that, you force. Or you have to be this or that. I think it all comes out from career guidance as well. Let us have children go to the, areas where they feel comfortable.
No, but sometimes you would actually imagine it's part of their training that you've got to be rude towards patients, but it's not how things are supposed to be. Nurses are supposed to be very kind, I grew up knowing that a nurse is supposed to be a beautiful woman. I only discovered later in life that there are also male nurses.
Yes,
But the
exactly.
nurses I interacted with back in the day, because taking you to hospital back in the day was a good thing.
But you know,
you'd be
Simon-
assured of a soda
No.
and a donut.
Me, I never loved hospitals. I think it's because I grew up around hospitals with a mom who is a nurse. So many medics in there in the family. I never loved hospitals because I used to smell a lot of drugs around the hospital, so I started hating it. But away from just the character of the nurses, Simon, there is a lot more that needs to be done, especially with the persons with different abilities. I want to look at the blind. I want to look at the deaf and dumb who cannot be able to speak. Do we even have translators in some of these hospitals? Can they be able to express themselves? Because a diagnosis is done, or I mean a prescription is done based on a diagnosis, which is an explanation from you, the patient. How do you feel? What symptoms? I have a fever, I have a headache, I have this and this. Then the doctor could be able to determine maybe that is this and be able to prescribe.
There is a very new trend, and I hope all hospitals will adopt this. Communication. There's a time I was invited to lecture medics on effective communication in healthcare. And I felt it was a good opportunity. There are quite a number of things. Sometimes we blame them, yet they are innocent in real sense, because all they learn is how to administer drug, how to register a patient, and that's all. Communication. That aspect of communication is
How
normally
do you
ignored.
speak to people?
How do you speak to people? But we've even come to think that maybe rudeness accompanies their job. Like, we knew back in the day that for UEB, these UEB boys, to erect a pole, they would accompany it with words. But well, let's move on to Gerald Mate.